In this video, you will be given aftercare instructions. Please refer to this pamphlet, which has great information in it. It will go over how to eat, how to ice, and your aftercare medications to take. Also included in the pamphlet is our clinic number that you can reach a nurse during the day, or aftercare doctor on call number.
Pain management is most effective if pain relievers are taken before the local anesthetic wears off. If you are given a prescription at your appointment, please take it as directed. If you are directed to take over-the-counter pain relievers such as ibuprofen or acetaminophen, Tylenol, please take as directed on the back of the bottle. Also, remember if given a narcotic at your appointment to not take it with alcohol.
Following oral surgery, you can experience some swelling. This typically peaks the first 36 to 72 hours. To help minimize the swelling, we ask that you hold some ice to the outside of your face. We'll ask that you put some ice in a Ziploc bag, wrap it with a washcloth, hold that to the outside of your face, way back by the ear area, 20 minutes on, 20 minutes off, and use that for the first 12 to 24 hours to help minimize your swelling. After your procedure today, you will be leaving the clinic and your mouth and face will be numb. Things that you can eat to start off with would be softer, easy to chew foods. We like to suggest things like yogurt, applesauce, pudding, jello, and then increase your diet as you feel comfortable over the next couple of days, whatever you're comfortable to eat. Typically, right at the beginning, we wouldn't want you to have anything too hot to injure your lip. Over the next week, definitely avoid things like peanuts, popcorn, and granola, things that would get stuck down in the sockets.
Keeping your mouth clean after surgery is very important. If you don't feel comfortable brushing your teeth the night of your procedure, please resume doing so the next day. If given an antibacterial mouth rinse prescription, please use as directed. If not, you are more than welcome to use an over-the-counter mouth rinse or a warm saltwater rinse. Half a teaspoon of salt to some water, stir, and rinse. Be sure to not rinse too vigorously and not forcefully spit back out.
After a procedure, bleeding can last up to a couple of hours. To help control the bleeding, you'll leave our office biting on a piece of gauze, which we'd like you to bite on for 30 to 40 minutes. We will send you home with a packet of gauze if you should need to replace one. To do so, take a piece of gauze, fold in half, roll, place on the surgical site, and bite for a continued 30 minutes. If after that you continue to have significant bleeding, take a tea bag, moisten it with warm water, squeeze out the excess water, place that on the surgical site, and bite for 45 minutes to an hour. If after trying these methods you don't have improved results, please notify our office. Following an extraction, there can be a delay in healing, commonly known as a dry socket. The doctors here at Madison Oral Surgery have treatments available that they use to minimize the chance of a dry socket. A dry socket is not an infection, but the symptoms of a dry socket can include a lingering throbbing discomfort that can radiate up towards the ear or forward in the jaw towards the chin, usually 5 to 7 days after a procedure. This type of discomfort many times is not controlled with the use of pain medicines and is easily treated with a short in-office visit. If the symptoms are left untreated, they will resolve themselves with time. Please call our office if you're experiencing symptoms similar to these. We thank you here at Madison Oral Surgery for choosing us for all of your oral surgery needs.